Guys, this is just an instructional video on how to do the Redline Breathalyser test, which is one of the tests you'll need to do for your drug and alcohol practical. So first things first, preparing the area. So I've got my documentation here, obviously the breathalyzer test, and I've got Kim's 2 forms of ID as well. So the first thing you need to do is obviously welcome the patient, make them feel comfortable. Like I said before, we've ID'd her, so we know it's her. And then you ask if they've had anything in their mouth, so food, drink, even chewing gum in the past 10 minutes. So Kim, have you had anything in your mouth in the past 10 minutes? No? No? All good. And now I did explain the procedure that we're going to do today to Kim. In your video, you'll obviously need to explain it to them, but for the sake of this video, I've already explained how we're going to do it. You'll need to ask for their consent. So Kim, do you consent to being tested today?
Yes.
Perfect. Just get them to sign. Perfect. Thank you. Wonderful. All good. So now we've got that ready. Now it's time to test the donor. So open up. So it'll be bundled up like this. So it'll be separated into 2 parts. So you've got the bag here, instructions on the bag as well, pretty easy to follow. And you've got the little insert piece here, which you'll insert in top when the time comes. Alrighty, now something I did forget to mention, obviously you have gloves on for this entire process. Alrighty, so we've got the bag here. We'll instruct the donor to blow into this mouthpiece here. So 1 long continuous breath, nothing too crazy. Keep going. Yep, stop. Perfect. Wonderful. So as you can see, it inflates quite quickly. Now you snap off the 2 caps on the red and the white side. So a bit harsh there. And just dispose of them in the bin. Other side. Wonderful. Got the test. And you insert the white end into, there we are. Again, quite forceful, make sure it's all the way in there, no air escaping. Alright, now you slowly expel the air from the bag. Don't press on it too hard, just nice and gently. You'll feel it escaping into the tube. Wonderful. Perfect, and now we wait. So we've waited the 2 minutes and now we're ready to analyse our results. Now what you were looking for is a change in the colour of the crystals from yellow to green. As you can see, that hasn't happened, they're all still yellow, which indicates that our donor has a blood alcohol content level of less than 0.02. As you can see, this line arrow indicates which direction we're to analyse the results from, and this circle line here is the cutoff level. So below this line, so this area here, if those crystals were green but not the crystals above the red line, then that would indicate that the donor has a minimum blood alcohol content level of 0.02. Now if all the crystals were green, including those above the red line, that would indicate that the donor has a minimum of 0.05% blood alcohol content level. So a couple of things you'll need to keep in mind when you're filming your videos. You'll need to make sure that you have the areas set up correctly. So that means having the correct documentation, the correct testing equipment, and having gloves available as well. You'll need to introduce yourself to the donor, make them feel as comfortable as possible. You'll also need to make sure that the donor meets the pre-test criteria. So for the breathalyzer example, that meant that they didn't have any water, food, chewing gum, anything in their mouth at least 10 minutes prior to doing the test. You'll also need to make sure that they understand what they're about to do. So with informed consent, you'll need to explain the process and how it works to them before they sign, stating that they're happy and consent to what they're about to do. Finally, you'll need to make sure that the documentation is filled out. So for example, with the breathalyzer scenario, obviously you would make sure that the alcohol test, blood alcohol content result, tunnel test, collection device brand, all that area is filled out. You wouldn't necessarily fill out the drug test results for this situation if we weren't testing the donor for drugs. However, you wouldn't leave it blank either. You would just put a dash through it if you did not test it. Good luck.